I have a real treat for you this week. One of my friends and colleagues, Dr. Greg Peterson, has agreed to do a free online course on blood chemistry with interpretations from a functional medicine perspective. The date, time, and details are posted to the right. What may be even better is that Metabolic Management has been given the right to share the course on our website, at least for the next 12 months. Dr. Peterson is one of those rare people who possess an almost photographic memory. And so his lectures offer a plethora of information on his almost 40 years of practice. He specialized in functional medicine for over 30 years and has taught postgraduate courses on blood chemistry around the country. By the way, for the postgraduate classes he teaches, he's not allowed to give the therapeutic products he uses and the dosage amounts. But since this is his class and CEs are not given, he can freely give the names of specific products he uses and dosage recommendations. He'll cover the basic chemistry panel as well as a CBC with a differential and a few specialty tests. He'll also cover some new inflammatory markers and what they mean. He'll share that standard lab ranges are 2 standard deviations outside the norm. This means 2.5% of patients tested are outside on the low end side of the lab range and 2.5% are outside on the high side of the lab range. In other words, when you're using traditional lab ranges, you're looking for disease patterns. Dr. Peterson will be looking at tighter physiologic ranges to assess health. When labs are outside optimal ranges, they reflect dysfunctional physiology. And as we're all aware, it's easier to prevent disease or treat it in the early stages rather than treat disease once it's fully developed. Here are just a few of the topics he'll cover. How to determine if a patient is B6 deficient. What are the best tests for optimum liver function, especially to determine non-alcoholic fatty liver disease? How to assess thyroid tests and how to determine if the problem is driven by a sluggish pituitary or a tired thyroid. And then how to determine if a sluggish pituitary is caused by an overactive adrenal pattern. What's the blood pattern that reflects the difference between hypo and hyperadrenal physiology and why? What to do with high or low ferritin, especially when iron is normal? How to determine if a person is suffering from long COVID or post-vaccine injury. How to read a CBC with differential, looking for B12 folate deficiencies. The differential can tell you if you have a chronic viral picture and autoimmune pattern developing. How to know if hidden infections can be the cause of chronic pain as well as cognitive disorders. How to know if someone's deficient in B1. What are the best tests to determine minerals like magnesium, calcium, and zinc? How to determine if someone is deficient in hydrochloric acid. What are the best tests to assess and monitor blood sugar dysfunction? Dr. Peterson has an online mentorship program in blood chemistry. It's just one of several modules practitioners can access, but this one is free. He also teaches courses on the following: how to do a nutritional physical exam, in-office testing, advanced blood testing, and functional urine analysis, and how to implement a nutritional questionnaire he developed. Using tools like these helps you to determine the best test to order. One of the things I like about Dr. Peterson's approach is his determination to address the core issues first. We can chase symptoms with nutrition just like traditional medicine does with drugs, but Dr. Peterson offers a system to economically assess and monitor patients that is reasonably priced. I'm a huge fan of lab testing, but it can be expensive. Using in-office testing, optimal ranges, and directed lifestyle changes can go a long way to facilitate wellness. After 40 years of attending weekend seminars, if I can find 2 or 3 things that I can employ with my patients on Monday morning, I feel the seminar was worth it. I guarantee you'll have multiple aha moments at this event. I know I'll be online trying to pick up some clinical pearls and hope that you will be there as well. Thanks for taking time to be with me. I look forward to being with you again next Tuesday.